COVID-19 vaccines are available for everyone ages 16 and up, and companies right now are currently doing vaccine trials for children. But many parents and guardians have questions about how they can keep their children safe and healthy right now. Joining me now via Zoom is Dr. Sonja Rasmussen, an epidemiologist and a professor at UF. Thank you so much for being with us this morning.
Thank you.
How should parents talk to their kids about the vaccine?
Yeah, we're all hearing so much about vaccines right now, and what parents need to tell their kids is the studies are being done right now to make sure that those vaccines are safe and effective for kids. And until then, we need to keep doing what we've been doing, keep wearing those masks, keep that six foot distancing, avoid crowded areas, and so on. We know how to keep ourselves safe until those vaccines are ready for kids.
When do you think children could have access to the vaccine? As we mentioned, many companies are in those trial phases right now.
Right. It's hard to predict exactly when those are going to be ready, but I think there's some good signs that there's going to be, at least for older kids, some vaccines ready sooner. You may have heard the exciting news this last week. The vaccine, one of the companies that is making vaccines has shown that kids 12 to 15-year-olds can get the vaccine, and it's safe and effective. Now they're going to be going for FDA authorization of that vaccine, but that gives me hope that at least for older kids, before the schools starts in the fall, that vaccines will be available. Younger kids, I think we're going to be waiting a little bit longer, maybe late 2021, early 2022.
And you mentioned some things that we've been doing for several months now, wearing a mask, washing our hands. What other things can parents do right now to protect their kids?
Well, I think those are exactly it. Keeping doing what we've been doing, and I know we're all sick of it, but wearing a mask, keeping the 6 foot distance, doing things outdoors. If you want to go out to dinner outdoors, avoiding crowded areas. You really don't want to be in a place that's poorly ventilated, crowded, and keeping washing those hands continues to be important.
What should parents do if their child does get sick with COVID-19?
Yeah, the most important thing to do if you think your child has COVID-19 is to call your child's doctor. Your child's doctor can, first of all, they know your child's background, they know your child's age, they know what your risk factors are for severe COVID-19. As you know, most kids that get COVID-19 get it in a mild way, but there are some kids that have been hospitalized and even had really severe illness. So parents need to watch closely and talk to their child's doctor if they're worried about that.
And what do you say to parents who may be a little bit scared or nervous about the side effects from the vaccine?
Yeah, there's no question that the vaccines that are available do have side effects. The good news is that they've now been given, they're not brand new anymore. They've been given to millions of people in the United States, and people have done well, but they have had some side effects. And what I tell people is those short-term side effects, that sore arm, maybe some muscle aches, some people have even had a fever, those tend to last a short amount of time. And that short, mild side effect is worth the protection that you're going to get, that your family's going to get, that our community is going to get from that vaccine.
Dr. Sonja Rasmussen, thank you so much for being with us this morning. Great information.
Great, thank you.